right. Good morning and thank you for joining us for this month's Policy Update webinar. I'm Trevor Rode, one of the Provider Relations Specialists with the Office of Medicaid Policy and Planning. I'll be walking you through all of the policy updates from November 2nd through November 30th, 2023. As we go through the updates today, please hold any questions and we will address them individually at the end. Updates today will be broken into newly covered services, claim adjustments, policy updates, reimbursement updates, and news announcements. So with that, we will get started. So let's start with newly covered services. We have a few to review today. Our first newly covered service came in BT 2023-157, where the IHCP added coverage for RSV immunization Beyfortus for the pediatric population. Beyfortus can be used in neonates and infants born during or entering their first RSV season and in children up to 24 months of age who remain vulnerable to severe RSV disease through their second RSV season. This is effective for dates of service on or after July 17, 2023, and the IHCP will reimburse IHCP enrolled providers for the administration of the Beyfortus RSV immunization for the previously mentioned eligible members. Providers should use the CPT codes listed in the table within the bulletin, along with administration code 96372, which is injection of drug or substance under skin or into muscle. Reimbursement is limited to the administration fee only, as this immunization is available through the Vaccines for Children program. The claim processing system is updated and claims will be mass adjusted or reprocessed for dates of service on or after July 17, 2023. Prior authorization and National Drug Code are not required. In BT 2023-158, the IHCP added coverage for RSV vaccine Arexvy. On May 3rd, the U.S. FDA approved the vaccine for use in adults aged 60 years and older, and this added coverage will be effective for dates of service on or after May 3rd, 2023. IHCP enrolled providers can be reimbursed through CPT code 90679 when administered to members ages 60 years and older. The claims processing system has been updated, and claims will be mass adjusted or reprocessed for dates of service on or after May 3rd, 2023. PA and NDC are not required, and the new code will be reflected in the next regular update to the professional fee schedule and outpatient fee schedule. Our finally newly covered service for today was announced in BT 2023-159, where the IHCP added coverage for RSV vaccine Abrysvo. The U.S. FDA approved the vaccine for use in adults ages 60 and older, and on August 21st, 2023, the FDA expanded the use for this vaccine to pregnant individuals between 32 and 36 weeks of gestation. Effective for dates of service on or after May 31st, 2023, the IHCP will reimburse IHCP enrolled providers for Abrysvo, billed with CPT code 90678, when the vaccine is administered to members 60 years of age and older. And effective for dates of service on or after August 21st, 2023, IHCP enrolled providers can be reimbursed for CPT code 90678 when the vaccine is administered to pregnant members between 32 weeks through 36 weeks of gestation. The claims processing system has been updated, and claims will be mass adjusted or reprocessed for the previously mentioned dates of service. Again, PA and NDC are not required. I also want to make a note in the beginning of this. I did say this was announced in BT 2023-159. I just want to state a correction that it was actually originally announced in BT 2023-59. So next we'll move on to claim adjustments, which we only have 3 to cover today. In BT 2023-154, the IHCP reprocessed claims for the expansion of coverage for Vaxneuvance to the pediatric population. The IHCP previously announced this in BT 2023-103 that it would reimburse IHCP enrolled providers for CPT code 90671 effective June 17, 2022. The claim processing system has been updated to expand age coverage for the vaccine to the pediatric population, and claims affected by this change can be resubmitted within 90 days from the date of this publication for managed care claims and 180 days for fee-for-service claims. Providers are asked to include a copy of this bulletin when submitting claims beyond the standard filing limit. Our next claim adjustment came in BT 2023-155, where the IHCP identified an issue with fee-for-service claims that denied an error for the following: waiver claims processed from noon on Monday, October 23rd, 2023 through midnight Monday, October 23rd, 2023, may have denied an error with explanations and benefits code 4021, which is procedure code is not covered for the dates of service for the program build. Please verify and resubmit. And medical services processed from midnight on Tuesday, October 24th, 2023 through 3:30 p.m. on Wednesday, October 25th, 2023 may have denied an error with EOB code 4801, which is procedure code not covered for benefit plan. The claim processing system has been updated and claims will be mass adjusted or reprocessed beginning immediately. Providers should see adjusted or reprocessed claims on remittance advices with ICNs or claim IDs that begin with 80, which is reprocessed denied claims, or beginning with 52, which is mass replacements non-check related. The final claim adjustment for today came in BT 2023-156, where the IHCP identified an issue with member copayments that may have been applied to fee-for-service claims from April 1st, 2023 through October 17th, 2023. IHCP members impacted by this issue were enrolled in the following benefit plans: Package A Standard Plan, Presumptive Eligibility Adult, 590 Program, Full Medicaid, Package C Children's Health Plan, or Presumptive Eligibility Package A Standard Plan. Cost sharing was suspended effective April 1st, 2020 due to the COVID-19 public health emergency, as announced in BT 2020-33. Providers should also revert to BT 2023-101 for additional information regarding member cost sharing. Claims that apply to copayment will have EOB code 9001, which is pricing adjustment, reimbursement reduced by member's copayment amount applied to the claim. The claims processing system has been updated, and claims will be mass adjusted. Providers should see adjusted claims on remittance advices beginning December 6, 2023, with internal control numbers or claim IDs that begin with 52. So we will now move on to policy updates, which we have 3 to cover today. Our first of the day came in BT 2023-152, where the IHCP announced new coverage or radiodiagnostic agents and an update to the PA policy for the radiodiagnostic agent Pylarify. Effective for dates of service on or after December 11th, 2023, the IHCP will cover CPT codes A9596 and A9800, which are indicated for positron emission tomography of prostate-specific membrane antigen positive lesions. PA will not be required for these codes, and the billing guidelines and pricing can be found within the bulletin. Effective December 11th, 2023, the IHCP will remove PA requirements for Pylarify. Coverage for Pylarify was announced in BR 2023-13. Billing guidelines and pricing for Pylarify, which is covered under CPT code A9595, can be found within the bulletin. Our next policy update came in BT 2023-153, where the IHCP permanently removed PA for continued use of respiratory assist devices, services, and supplies effective January 1, 2024. Providers will not have to request PA for continued use of the items listed in the table within the bulletin. However, providers are still required to document an attestation of medical necessity and a member's acknowledgement of usage compliance within the member's medical record. This change applies to all IHCP programs in both the fee-for-service and managed care delivery systems. Please refer to the bulletin for additional details. Our final policy update came in BT 2023-168, where pharmacy updates approved by Drug Utilization Review November Board were made at its November 17th, 2023 meeting. Changes were made to the Silent Auth automated PA system, PA criteria, mental health utilization edits, over-the-counter drug formulary, OTC supplements formulary, OTC contraception formulary, and statewide uniform preferred drug list as approved by the DUR board. These detailed changes can be found within the bulletin, including tables for any changes that were made. All of these changes will be made effective for dates of service on or after January 1st, 2024, unless otherwise noted. We now move on to reimbursement updates. Today we have a few normal reimbursement updates, followed by a COVID-19 reimbursement update. In BT 2023-150, the IHCP announced that to comply with the 21st Century Cures Act, it will update the rates for select DME and medical supply HCPCS codes. The Centers for Medicare and Medicaid Services will be releasing the code list in January 2024, and the list of impacted codes, along with their updated rates, will be published after changes have been completed. The IHCP will use the lowest non-zero 2024 Indiana Medicare durable medical equipment, prosthetics, orthotics, and supplies fee schedule amount as the Medicaid allowed amount for dates of service on or after January 1, 2024. The 2024 DME OPS fee schedule will be available on the CMS website, which can be accessed from the bulletin. Our next reimbursement update came in BT 2023-165, where the IHCP updated coverage and billing information for the 2023 October HCPCS codes. Unless otherwise specified, all information in the bulletin is effective October 1st, 2023. There are multiple tables within the bulletin showing these changes, and all changes to CPT and HCPCS codes from the 2023 October quarterly update have been added to the claim processing system. There is also additional information for COVID-19 vaccine codes within the bulletin, and this should be referenced for more details for these updates. In BT 2023-167, the IHCP addressed billing issues in connection with rate changes in IHCP bulletins BT 2023-59 and BT 2023-78. The issues concerned claim processing, care management flat rate, batch billing, service authorizations, and structured family caregiving level 3 services for the Division of Aging waivers. Care management for social services does not batch bill services except for CMFR. Instructions providers can follow for all services except ones that are billed for CMFR can be found within the bulletin, along with more CMFR information and structured family caregiving services information. Our final regular reimbursement update came in BT 2023-169, where the IHCP announced a fee schedule for ABA therapy services. This fee schedule, which is effective January 1, 2024, will be implemented as a minimum fee schedule, and the managed care plans must reimburse providers at or above the fee schedule rates. ABA therapy services will also have a new procedure code modifier combination that will need to be billed on the claim for appropriate reimbursement. These combinations are listed in the table within the bulletin, and providers will begin submitting claims using this fee schedule with dates of service on or after January 1, 2024. Our one COVID-related reimbursement update came in BT 2023-162, where the IHCP announced pharmacy benefit updates to COVID-19 vaccine reimbursement. The US FDA announced an amendment to the emergency use authorization of Novavax COVID-19 vaccine on October 3, 2023. This has been adjuvenated to include the 2023-2024 formulary. The original Novavax COVID-19 vaccine adjuvenated will no longer be authorized for use in the United States. Effective for dates of service on or after October 3, 2023, the IHCP will reimburse IHCP enrolled pharmacies for the updated 2023-2024 Novavax monovalent vaccine and administration when given to applicable IHCP members as approved by the FDA or authorized for emergency use and recommended by the Advisory Committee on Immunization Practices for the Centers for Disease Control and Prevention. Pharmacies that submitted claims with dates of service on or after October 3, 2023, but prior to this publication, may reprocess the claims to be reimbursed for the ingredient cost. More specific details can be found within the bulletin. So we will now move on to our news announcements, which we have multiple to cover. We will start with two clarifications. In BT 2023-151, the IHCP clarified weekly reimbursement bundles for OTP services. On July 1, 2023, the IHCP replaced the per diem reimbursement bundle under HCPCS code H0020 to weekly reimbursement bundles that are currently being used by Medicare for payment of OTP services. To clarify dates of service, in alignment with Medicare, the IHCP requires the dates of service on the claim for the bundle rate to be listed as the first date the patient was seen in the 7-day period. Under this new reimbursement structure, individual days cannot be billed. There is also a list of additional services within this bulletin that were added to the bundle. Specific information on codes for take-home supplies and place of service codes are also touched on in this bulletin. I highly recommend referring to the bulletin for the information on these codes. Our final clarification comes in BT 2023-161, where the IHCP clarified the locum tenens policy that applies to healthcare providers. Providers can create a locum tenens arrangement when the regular healthcare provider must leave their practice due to illness, vacation, or medical education opportunity and does not want to leave their patients without care during this period. The locum tenens must be the same discipline as the regular healthcare provider. This policy applies to the following healthcare providers according to the Social Security Act: doctor of medicine or osteopathy, dentist, optometrist, podiatrist, or chiropractor. The locum tenens agreement is used in a single or group practice, but the locum tenens healthcare provider cannot be a member of the group in which the regular healthcare provider is a member. The locum tenens healthcare provider usually has no practice of their own and moves from area to area as needed. These arrangements should not exceed 90 consecutive days, and if a healthcare provider is away from their practice for more than 90 days, a new locum tenens would be necessary. If a locum tenens provider remains in the same practice for more than 90 days, they must enroll as an IHCP provider. Please refer to the bulletin for a summary of the policy. So moving on to non-clarification news announcements, the IHCP requested provider feedback on IHCP Quick Hit videos in BT 2023-160. Over the past year, the IHCP has posted these short videos for more information on a variety of topics, and the IHCP would like to gather feedback on possible future topics. A survey can be found within the bulletin, and this must be completed by December 31st, 2023. Our next news announcement came in BT 2023-163, where the IHCP reminded pharmacy providers to submit claims with appropriate DAW codes. This was previously announced in BT 2012-02, but the IHCP reminds fee-for-service pharmacy providers to submit point-of-sale claims with the appropriate dispense-as-written codes. The Indiana Medicaid statewide Uniform Preferred Drug List prefers some brand name drug products over corresponding generic equivalent products due to financial advantages available to the Medicaid program from federal and supplemental rebate agreements. The bulletin includes a table with the DAW codes and the description of the codes, so we recommend providers review this information within the bulletin. In BT 2023-164, the IHCP advised providers of compliance program resources which are offered for free from the U.S. Department of Health and Human Services Office of Inspector General. These are to encourage the development and use of internal controls to monitor adherence to applicable statutes, regulations, and program requirements. The HHS OIG recently posted information on this, which can be accessed from within the bulletin. Our final news announcement came in BT 2023-166, where CMS announced a new provider enrollment application fee for 2024. Effective January 1, 2024, IHCP providers subject to the application fee will be required to pay an enrollment fee of $709 with initial enrollments, changes of ownership, and enrollment revalidations. Applications submitted online or postmarked before January 1, 2024 will be accepted with a fee payment of $688. Applications submitted online or with a postmark of January 1, 2024 or later must pay $709. So these are the bulletins we discussed today and each article included. All of these can be found on the provider section of the Indiana Medicaid website, and I'll stay on each slide for a few seconds. So I'd like to take just a couple minutes to go over the resources we have available for providers and ways that you can reach us when you have questions. When you have questions or concerns, you can reach out to your regional field consultants. Each MCE and Gainwell Technologies has representatives assigned to each area of the state. They should be one of your first points of contact when you have questions. Our provider reference materials can be found on the IHCP provider website. These materials include our bulletins and provider reference modules. These will help keep you up to date with all of the new information coming from the IHCP. The Provider Education tab on the provider website provides information on all the different trainings, webinars, seminars, and other education opportunities available to you. If you are not yet receiving our weekly emails that introduce our provider communications, please go to the provider website and scroll to the bottom where you'll see a box just like this. Enter your email address and you'll be signed up to receive an email each week with links and summaries of the bulletins and other provider communications. If you've reached out to the customer service teams and the regional field reps of the MCEs or Gainwell Technology and continue to have questions, you are always welcome to reach out to the provider relations team with OMPP. We are available to you as well. You can reach us via the OMPP provider relations email on the screen. The IHCP listens inbox is another way you can reach out to us. This inbox is specifically for us to receive feedback on our presentations, outreach, and education opportunities, and to let us know if there is a void in the information we are giving to the provider community. I think of the two email boxes this way. If the answer to your question is specific to you or your facility, email the provider relations inbox. If the answer to your question would benefit the entire provider community or everyone in your provider specialty, send those questions to the IHCP listens inbox. And if you have any questions about provider enrollment, you can always reach out to my colleagues at the enrollment email address on the screen. At this time, we're happy to answer any of your questions. Please go ahead and type your questions in the chat box and we'll address them one at a time. If we do not have the appropriate subject matter experts available to you right now, we'll take your question back to research. We may ask you to send your question to the OMPP provider relations inbox so we can send the answer when we have it ready. And I also wanted to put the survey on the screen here as our final request. We care about your feedback. We so much we want to hear about this webinar too. How can we provide information to you on a monthly basis? Again, you can scan the QR code and you'll be able to take this survey. So thank you for your time and for being an IHCP provider.